Welcome to a special edition of the Pharmacist Matters podcast. I'm your host, Justin Bates. This is an opportunity to talk all things testing. I have a couple of great guests that I'm really excited to have a conversation about how they have gone about implementing symptomatic testing, but I also want to broaden it out to all of the things that we're hearing about on social media, in the media, and the politics behind all this testing and what's the right thing to do. How are we going to ensure we're protecting our communities and granting greater access to families for what's a really important tool in combating the pandemic? So we're going to jump right into this. My first guest is Mina, and I'd love you to introduce yourself, and then we'll go to Jen.
Hey, Justin, great to be on with you guys today. My name is Nina Massey. I am the pharmacy manager and owner of Victoria Commons Pharmacy in Scarborough.
Excellent. Great to have you with us. Jen.
Hi, everyone. Thanks for having me. I'm Jen Baker. I am the past chair of board directors for the Ontario Pharmacists Association, but also pharmacist manager and co-owner at Loyalist Pharmacy in Amherstview, Ontario, just outside of Kingston.
It's great to have two pharmacists, OPA members who practice in different areas of the province. So I think some of your insights and experience that you've had on the front line is going to be really valuable for all your peers and anyone that's interested in understanding what does this all mean? How is it operationalized? How are we doing this safely? And I think part of what you're seeing as a bit of challenge is confusion, right? There's so much information there that people are trying to digest to understand, where do I go? Am I eligible? Do I have to pay, or is this covered by government? And when we started advocating for an expanded role for pharmacy professionals to be involved in not just the vaccination program, but also other tools like testing, back in September 2020, there was the initial program that was for asymptomatic individuals. We were only able to get 211 pharmacies to participate, largely because government wanted to have a very targeted program and had capped the number of pharmacies that were able to participate. That said, we were advocating really since day one to make sure that it was equitable in terms of the enrollment process and making sure all pharmacies that wanted to be involved in the program could eventually be onboarded. And it took quite a bit of time to get there, but we had lots of lessons learned from the initial program, which ended up doing almost 750,000 tests with a positivity rate through pharmacy of about 1.4%. I think it was a tremendous success, given the fact that this was our first foray into that. And at that point, we were still looking at all of the requirements that were needed to do this safely, with the IPAC protocols, the PPE, and all of the other measures that needed to be put in place. So from that, we were able to build on that program. And recently, the government announced, after discussions with OPA, an expanded program into symptomatic testing. And similar to some of the reactions that we had with asymptomatic testing, there was some initial pushback, I think fear of the unknown, some challenges around communications of what this program means, and also just explaining how it can work. So as we did some of our outreach, we wanted to give everyone the confidence that as OPA was negotiating this with government, we were also working with OCP, our college, to update their guidelines and make sure that everything was done in the right way, with the appropriate safety measures in place. And that was all done before the launch. And one of the key principles of launching this and working with government and many other stakeholders was to make sure that this was done on a voluntary basis. And we encouraged all pharmacy operators, managers to have really transparent conversations with their pharmacy teams to make sure there was a level of comfort, to explain the program, and make sure that there were alternative options available if someone wasn't comfortable participating in the program. And I think there were some early challenges in the first couple of days as information became available about how this was being implemented in certain models. But I do believe we've course corrected that, and we have really been on the forefront to make sure that people understand that this can be done in multiple ways. The most safest pathway to do this, and the preferred method, is outside. We all know that at this stage in the pandemic, COVID is airborne. So there are limited cases where doing it indoors can be done safely with the appropriate ventilation, making sure there's no commingling of patients and customers, and really managing that on an appointment-based model so that you can space out the appointments and manage the flow of people coming in. But as we were negotiating this with government, discussing how this could optimally be implemented, it was very clear that we wanted to make sure that the definition of on the premise testing included the immediate vicinity outside the pharmacy. And I think that was a bit lost in translation initially and misinterpreted. But the good news is that many are doing this within the premise around the pharmacy, so that you can collect the sample, bring it in, and do all of the administration and stuff inside. So that's, I think, one way to manage it. There's also a great feature here where it's a drop off for those that have received the PCR test through education. So education workers can bring it, having had it distributed through the school boards, and drop it off. And those individuals can come and pick it up from a pharmacy and drop it off after doing a self-collection, self-testing. So there's multiple modalities that give people options. And I think the word choice and options is also something that we take very serious at OPA, because what we're trying to do is we're advocating for scope of practice. We're not here to dictate how you implement and what you implement in your individual practices, but we want to give you options. So by having scope like testing that could eventually evolve into things like rapid testing for HIV, for strep throat, INR testing, the future here, I think, is limitless when it comes to the role as a healthcare community hub, and in particular, this patient access component. But at the end of the day, if you don't want to do it, then that's a choice you're making. And I think that's something that everybody needs to look at from the perspective of advocacy. Is we're here to give you the options of how you're going to implement services and support you through that implementation process. So that's the program and how it's been set up, and some of the leading up to implementation discussions that we had with some of our members and the ministry. And I know now we have about 600 stores as of today that have onboarded. We had about 1,300 initially that had put their hand up that wanted to participate across the province, because it was an open process. Anybody that wanted to be part of this could. And at this stage, we're still going through that onboarding. There's one last piece to this whole program, which is the rapid molecular testing for northern communities in Ontario. And that's something that's still being onboarded, but that would use the ID Now, which would require a quicker turnaround and no transportation and the shipping costs, et cetera. So that's something that's still in progress. And I think as we're hearing more and more about the need to get rapid antigen testing into the hands of households to be yet another tool to make sure that people aren't out there spreading and transmitting the virus, that's something we can talk about, because as pharmacies, I think we can play a great role in distribution and education. So with that frame of context, I wanted to get your perspectives, Mina and Jen, to, what's this meant for you as a frontline healthcare provider, as somebody who has gone through this process with your patients? Give me a sense, maybe I'll start with you, Mina, what this has done for your practice and how you view testing in general.
So I'll be honest with you, we would have never done testing if we were limited to doing it indoors. It just was not going to work for us. Our staff didn't feel safe having it indoors. We share space with the clinic, and the doctors in the clinic, their staff didn't feel safe. They're still doing phone appointments, unfortunately, but they're still doing some phone appointments right now because they don't want to see patients who may be sick. So for us, it had to be outdoors, and it makes sense for it to be outdoors because of the ventilation, because it's airborne. In terms of what it's meant for the practice, it has brought up so much goodwill in the community. Like, I cannot stress that enough. Patients are extremely appreciative. I think I shared this story on Twitter a little while ago, but we had a single mom with 2 kids who was not able to get an appointment at the testing center. The only way was, she was thrilled that we gave her the time. And literally it was 5-10 minutes. I was out there to her car. We did the test. Results came back. She's able to take kids back to daycare and school. It makes all the difference. And not just for us, honestly, for other healthcare professionals. We have a lot of the patients that come into the doctor's office who are not supposed to come in with symptoms. And once they walk into the doctor's office, well, they say, well, actually, I also have a cough and a runny nose. Can you write me an antibiotic. And at that point, the doctors in the clinic are freaking out because it could possibly be COVID. And then right there on the spot where we're doing the test for these patients, we're taking them to their cars, we're doing the test. Those patients were probably not going to test altogether. And if any of them are COVID positive, they will make sure that they spread it to everybody around them. Like there's nothing that stops them.
Well, that's part of what when I hear about safety concerns, it's always paramount that we do these things in the safest fashion as possible. You have those conversations with your staff, but the risk is there when you go. Like people will go to a restaurant, people will go to a sporting event, where once you're seated, you can take your mask off. You're shoulder to shoulder in some cases with people. Plus, people can come in without screening, without being vaccinated, and do shopping at the grocery store, other places that could be either asymptomatic or symptomatic. So risks, I mean, it's all about risk threshold and how you manage that. But it exists even without the symptomatic testing within the pharmacy. Yeah. So maybe Jen, you can provide some of your insights into what you've heard about testing, as controversial as it's been, how it's going, and some of the conversations you've had with your patients.
Yeah, and I think maybe I just want to jump on that sort of risk discussion, because I think it really is naive to think that people with symptoms that belong to the COVID-19 suite of symptoms aren't going out and doing things. I think there's definitely a lot more of that thought that, especially once you're vaccinated, that you're safe. And I know that as much as we have the screening tools in the pharmacy, you have people coming in, kind of coughing into their sleeve and going, where's your buck, please? And just not thinking about it in the sense of COVID. So, I think that it's something that, we need to appreciate, that just because we're providing this service that's for people with symptoms, I'm filling antibiotics. I still have cough and cold products that are moving off my shelves. And, these are for people who are symptomatic as well, too. And, it's naive to think that people aren't going to be leaving their homes and are going to just be strictly adhering to those self-isolation protocols. And, that's why we're kind of going into this fifth wave. So in terms of the testing, we hear a lot about it. And I think what I've heard most from my patients is just a huge and resounding thank you, like to really echo Mina's experience there. My community is absolutely thrilled that we're doing this. Right now, my region is burning. We have, I think it was, 100 and some odd new cases today. Our test positivity rate is right up. We were in an area that historically did very, very well. And now it seems like the house is falling down around us. And with those number of cases going on in the community, that's a lot of close contacts, because people are not self-isolating. They are still continuing to congregate in private households where vaccination status is unknown, where people are unmasked, they're in close quarters. And the number of people with a huge number of contacts that have to go through this tracing protocol is just increasing at an exponential rate in our community. And, people are thrilled to be able to get in earlier, because right now, as of today, our assessment centers in Kingston are booking out for Sunday. And we're seeing that number of cases. So that access to the ability to test is crucial. We also have patients that are super grateful to be able to add on that rapid testing feature to their testing appointment. They may be symptomatic and we're doing that PCR for them, but they asked if they'd be able to pay for a rapid test at the time, so they know they can get a jump on having that answer. And just today we had about 5 of them that added on a rapid test to their symptomatic appointment that came back as a preliminary positive. And we're able now to go through that process of, starting to trace down their contacts and get them in for testing sooner. So I see pharmacies as just a key part of this effort to test and trace, because our public health units are overwhelmed right now, especially in areas that are seeing those high positivity rates. As we go into boosters, as we go into school immunization programs again, we just don't have enough health human resources in the area. So pharmacy adding this on in ways that are safe makes absolute sense. And the community response has been really exceptional. I've actually had people transfer in because I was able to give them an answer about how I was going to do it safely in my practice. And they, just felt worried about it in the general community sense. I've also seen a lot of conversation on social media from my peers about sort of what this means. And there has been a big fracture, I think, in people that feel that they're being forced to do this unsafely, that those conversations haven't really been had, or they feel that they're not really going to result in truly safe practices. And that fundamentally breaks my heart, because as an autonomous healthcare professional, I have, the ability and the right and the duty to dictate my practice and put the safety of my patients at the forefront. And, we had those conversations in my pharmacy with, not just my other pharmacists, but my assistant, anyone who comes in. We took their opinions to heart, and just like, our layout doesn't allow to do it inside safely. So we do a purely drive up, curbside or in-car method, and we've created and put up the signage, and looked at ways to ensure that we're directing people in the right ways. And for anyone that feels that they have to do anything in their practice that's unsafe, I think you need to take a really hard look at sort of where you are with that and what you can do about it, because this is wider than just testing this problem. I think it's really come to a head over this, and we're starting to have those conversations, which is a really good thing. And understanding really where we need to support pharmacists more and being able to advocate for their own safety and personal safety. But as a mom with a toddler that comes home with a snotty nose sometime, the ability to be able to access testing quickly in those settings is absolutely critical, especially in those cohorts that aren't completely vaccinated or can't be vaccinated just yet.
Yeah, I wanted to sort of draw out that a little bit, those conversations that you had with your support staff and colleagues. And maybe Mina, you can give us some insight on how those conversations went, and what do you think we need to do to better support the profession to be able to make these choices and feel supported. And I think that's because a large part of what we're hearing is that challenge of like, I don't want to do this, I don't feel safe. And there's an economic component to this as well, but in the context of testing, how did that go from your perspective?
So honestly, it has to be on an individual basis, right? Like, we respect every person that's in that store, whether it's an assistant or a pharmacist or whoever. We have an assistant whose mom is going through chemo right now. So for me to force her to, be in any kind of danger, she can carry something to mom, that's irresponsible. That's not human. I think where we should be past this stage, at least for this profession, where we're forcing people to do things that they don't feel comfortable doing, or pushing quotas or doing whatever else. I think that should be over. That's done with. There's enough self-respect for this profession that we're not going to allow something like this to happen. At the same time, we also have to look at what we're doing for the community. So I'm going to go back to your Buckley's example. It's a lot more dangerous for us to have that patient. And I literally had this happen about a week ago. This lady comes in, mask is below her nose, and she's telling me she's looking for a cough syrup. Well, first thing is, can you please put up the mask? She puts up the mask. Well, when does the cough start? Well, it started 3 days ago. Okay, talk. Well, it turns out she was in the Dominican. She feels that she's fine because she's had a PCR test done before she came, and she's double vaccinated. She finally decides that, well, there may be a possibility we do a rapid test. The rapid test is positive. So I ask her to kindly step outside because there's staff and everything else. We go to the car. I do a PCR. Her PCR is positive. There's 12 people that were with her, part of her group in the trip. They all came to test. 10 of them were PCR positive. 3 of them were actually sick on the trip and tested in the Dominican, and the Dominican gave them a negative test. So just to kind of leave that out there, God knows what's happening when these tests are being done overseas, but these patients feel secure. They feel fine. It's just a little sniffle, just a little cough. We're okay. But it's spread through that group. 10 out of the 12 were positive, and God knows how many people they could have met later on, and they could have spread to them, and it could have gotten quite dangerous. It's a delicate balance. You have to make sure that you're keeping everybody on your staff, everybody from your patients, to be safe. But at the same time, if we're not doing our best to help our community, it's just going to get worse.
As you said, it's an opportunity to step up and provide greater access. And it's not for everyone. You have to look at your store layout, what your outside capabilities are, staffing levels, ability to adhere to the IPAC protocols. All of those things would be considerations. You have to go through that checklist before volunteering to do that, and those conversations you've mentioned, right? And maintaining that professional autonomy and making sure everyone's supported through this process. But that's a really, what you've mentioned, it tells you right there what the benefit and the value is to the community, because every person that comes in, and we hear about a lot of these stories where they become positive now, you've just stopped that from spreading that much further, right? And that transmission rate multiplying, because particularly with the new variants, the Omicron or even Delta still that's dominant, we know it has high transmissibility, and getting it early is really important. So the debate now, particularly in Ontario, is should we be funding and getting access to everyone to have rapid tests, free rapid tests through distribution channels like pharmacies? Lots of debate. I don't think anyone's doing this in Canada yet, although I know Alberta and some of the other provinces are looking at it. I think the UK has done this and done it quite effectively in terms of getting access to all of these rapid tests. Well, what do you think, Mina? Is that something that the government should be funding, and should pharmacies be looking?
100%. It's a no-brainer. This should have been done a year and a half ago. There's no reason for us to limit access to testing. It makes no financial sense. If they are buying these in bulk, it will cost them about $1 a test. Mm-hmm. It's a lot cheaper than keeping somebody in ICU. It's a no-brainer. It's pretty late in the game. It should have been done a long time ago. And honestly, it's going to take a lot of burden and a lot of stress off of the system that's really suffering right now. We're at a breaking point.
Yeah, I mean, your point about a prevention, right? And stopping it at that point is so critical, because even for asymptomatic, right, they can be going around feeling fine and spreading the virus. So you have that element, and then you have the more obvious one where you present with more symptoms, 3 or more symptoms, where it could be very much COVID. So do we have the capacity? Do we hear a lot about capacity, health, human resources, got the vaccinations happening. What do you think, Jen, about capacity and where we're at from a distribution and administering these tests?
Yeah, it's a great question, because really, I think we're starting to turn that corner on a bit more of a pharmacist shortage. I've been sort of noticing in the climate and the hiring market, we're seeing a lot of jobs being posted, people moving back to offering things like signing bonuses, and even just trying to find help in my own region has been near impossible. And yeah, this last week has been wild when it comes to just the demand for pharmacy services, which, I look at it from the macro sense and go, like, this is amazing, right? These are all services that I'm being paid for, some appropriately, some, maybe still leave some room to be desired. But I could very easily fill mine and another pharmacist day with solely pharmacist-based services, and then still have another person dispensing, where previous to this, I was at the point in my growth cycle where, I was still kind of looking to fill my day with other things to do. So the capacity definitely, can be a challenge. I think the rapid testing for households would be amazing, and distributing it through pharmacies makes sense, because we can provide that education on how to properly use those tests. I think that education absolutely needs to be funded if we do get involved in that distribution, because the proper use of those tests is really so critical. Because as bad as not having access to the test is, not using it properly and having that false sense of security is also not a good thing in a lot of those scenarios. And when you see just the way people use masks, I fear for how people will use tests. So we do need to give them that education. And it's not just as simple as kind of wiggling a Q-tip around in your nose. It kind of is, but you do need to have that processing done correctly and know how to read it. So I think pharmacists do have a role to play in that, but definitely, doing things like advocating for scope of practice on technicians for injections and for COVID and flu injections has been huge to taking some of that burden off the pharmacist's shoulders. But in community, we don't have enough technicians, and we're not using them to their fullest extent even now. So I'd love to see more access to pharmacy technicians with their injections training coming in to do that. But yeah, definitely from the workload standpoint, I'm sitting here with my lunch beside me. It's been a 9-hour day in the dispensary and it's sitting beside me cold and soggy, but I'm looking forward to eating it at some point. Capacity is definitely an issue because we still have all yeah, you're probably in the same boat. It's a Western sandwich. It's looking pretty unappetizing at this point. But yeah, we're adding to the capacity of the system, but we do need to think about how we pace things and how we support our pharmacists, our technicians, our assistants, everybody's answering our phones, because with this comes all of the communication around self-isolation and what people should be doing, whether they're vaccinated or not, providing that good information. Because I know in our region, our contact tracers are pretty tapped out. We have people that are getting calls, 10 days after they test positive. So they're looking to their pharmacy for what they should be doing, how they should be doing it. And, fortunately, because we're providing that testing, we are being reimbursed to do that. But yeah, finding that help to do it, ensuring that we have the capacity to take care of all of our regular patients is top of mind as the manager at my pharmacy. And it's not something that's lost on me that many pharmacies won't be able to handle that based off of their current workload. And, understanding that and, taking on what they can actually perform is critical to maintaining safety and maintaining access to all the things that pharmacies do.
I think there's a paradigm shift here, and like anything, it's an adoption curve, right? When you bring in new things and change is always difficult. And we have to make sure all of the things you've talked about, the capacity, the HHR component, the support and the financial framework to be able to do this in a fair and reasonable way, the tools, all of those things, the infrastructure needs to be lock in step with scope of practice. But where I see the huge advantage right now is just how people view you as a healthcare professional. I'm not as convinced pre-pandemic people saw pharmacists the way they see them today. I mean, I don't have the data yet. We're doing some polling, but just anecdotally, what I see people talking about pharmacy and pharmacists and how important they've been to their lives, right, in managing their health, but now the access, which is both a blessing and a curse in some ways, right? We're the most accessible, but that creates challenges when policy changes in government. You're getting phone calls. It's flooded. But I think the long term is going to benefit the system as we look at how do we create a more integrated healthcare system? What do we learn from the pandemic in terms of the gaps and how pharmacists have really stepped up and provided solutions throughout, testing being one of many that have been rolled out. But again, we have to do this in a measured way. And this is not a sustainable model where, we can continue for years and years without the appropriate reimbursement and all of the other pieces that we've talked about. But I do think the dinner table conversations are now including pharmacists as part of the healthcare team. And that's invaluable. It's invaluable for advocating at the grassroots level. It's also invaluable for you as a profession to be I think one of the most trusted and recognized providers, and that's something to be proud of. I think collectively as a profession, but there's a lot of work to do. It never ends, and it won't end with the pandemic. We've got minor ailments coming. We've got routine immunizations that we're advocating for. Minor ailments is 10 years in the making, and we're hopeful. But part of that is looking at it to say we need to continue to give choice. How do we implement a program like that really changes how you practice with prescriptive authority, get your foot into that door, if you will, and it will transform how patients view and access these services. So I don't know, Mina, if you want to provide some commentary on the capacity issue and how you've managed.
Capacity has been a huge issue. We've been trying to fill a shift for about 3 weeks now that we are still unable to fill. And I put it on pharmacy groups. We call people, and honestly, it's also another portion of it is some pharmacists are not comfortable doing everything as of yet. So a portion of it is what you are offering. Obviously, you're offering them a greater package for doing the extra things, but not everybody feels trained enough. Not everybody feels comfortable enough. Nobody feels safe enough. And you can't push anybody, obviously. You want to make sure people are practicing to their scope of practice. We've been having issues, honestly, finding good assistants, good technicians. Finding a good pharmacy assistant with experience right now has become extremely difficult. We're in the process of teaching some people to do the pharmacy assistant job, but obviously, as Jen could probably comment on this, it's very difficult. It's not easy to start somebody off from zero. But I'll go back to your point about like how we're viewed right now. Honestly, we're heroes in the community. The perception has been incredible. While other colleagues and healthcare professionals closed their doors, we stayed open. And I think that's not lost on people. That makes a huge difference for our patients. There's a level of trust that we've had before the pandemic, just being part of the community, and it's at a completely different level right now. They feel there's a trust factor there, that they're not going to be let go, that they're not going to be discarded, that we're not running away from them if they have the sniffles, and that's a huge thing. When a patient calls you and says, I need a PCR test, and you're willing to go outside and do it for them, but they've called their doctor and the secretary just 30 seconds and hung up on them because, they're scared to see them, right? Like, and it's understandable. It's understandable. It's a pandemic. But we were there for them. And I think that goodwill is never lost.
Yeah, that access, remaining open, not closing doors. And now we just have to manage that, right? Now we have to make sure that as we roll things out, that there's the appropriate time to prepare from a communication standpoint, from supplies, all those things. And, that's ironically, we learned that from the vaccine rollout. Even though we were advocating for more time to communicate in advance, there were some challenges in that respect. But I would say that the COVID testing was something we were able to communicate weeks in advance. Unfortunately, it did leak out before a formal announcement, but those are the risks you take, right? And I think in the end, getting the information in the hands before the public comes in is so critical to helping manage that burden and stress, right? Because everybody's burdened in the healthcare system. And it just feels like we're piling on more and more of this, variants, and, is there an end here, right? And I think hope is, that's what we need. We all need hope that there's an end or a better way to manage this if this becomes an endemic. But mental health, the burden on the profession, Jen, maybe you can comment on that, because I know you talk to a lot of your colleagues, and it's a big emphasis for us heading into 2022. What can we do better to support the profession?
Yeah, I think it's a really great point, because severe burnout in a lot of cases mirrors that high functioning anxiety, and really does take a toll on people's mental and physical health. And we're hearing it. We're hearing people that are just physically exhausted all the time. They're irritable. They're quick to anger, quick to tears. All these sorts of things that aren't necessarily normal for them in their day-to-day life. And really, when you look at it and you're kind of going, okay, like, I'm a healthcare professional, I've got this duty to my patients. If you're a pharmacy owner or manager, you're kind of like, okay, we got to keep the doors open. People still need to get their prescriptions. If I can't show up every single day and be running at 150%, then the world's going to come down around us. And I think we do need to take a step back. We obviously, the health human resources is key, right? We're asking everybody to do more with less. And there does come a point where it starts to feel really risky. And that in of itself takes its toll, right? If I feel like I'm working in an environment where I can't keep up to the point that it's unsafe for my patients, it's therefore unsafe for me, and something needs to change there. So I think we do need to have some of those candid conversations around things like the expectations around volume, around how we properly staff community pharmacies based off of the type of mix of prescription services, demographics, those sorts of things. I think we need to talk about the expectations and the support that's offered in the workplace, even just things like personal days for mental health days, or the ability to take a sick day when you have symptoms. I think is probably somewhat problematic in our profession, but we're not really talking about it. So these are all conversations that need to happen. And as the landscape of how we manage our time as professionals and what we do with our time and what we're reimbursed for all modernizes, I think it's a great opportunity to do that, because I know in my practice, I've definitely seen this shift as we've moved to basically almost, probably a 70-30 services dispensing split here. The respect for my time as a professional by my patients has gone up exponentially. People are expecting to make an appointment to see me and talk to me. They will wait patiently, they will come back, they will book an appointment ahead of time, and there isn't that same sort of expectation that everything happens instantaneously. And that's a huge win for pharmacy professionals, because accessible has always meant that, you're there and you can provide instantaneous answers, and your prescription is going to be ready in an instant, or they'll take it down the road 200 meters to another pharmacy. This switch really, I think, is foundational in how people view pharmacists, as both you and Mina have said. But with that trust and that sort of adulation and grateful, the gratitude that comes with that, also is that level of respect, and people are seeing our pharmacists and pharmacy technicians as healthcare heroes that are worthy of respect and respecting their time. And that's something that I don't think I've really seen or appreciated before, or always felt like I had to really reinforce that, my time was worth something, and, spending good quality time with someone uninterrupted was worth defending. And I think people really get that now. And that will, I think, be really key to that transition to more reimbursable services, and how we orient our pharmacies and dispensaries, and how we deliver care.
I think you captured it really well with that shift in terms of people looking at it as not, this is a quick in and out, in the sense that I am going to have that quality interaction with a healthcare provider that can help me, right? And that requires a change in the workflow in some respects, even configuration of the stores in a lot of ways, to have that opportunity to sit down with a patient, and it's appointment based. And it's a behavior, it's a learned behavior, right? When people come in and there's an expectation, and they don't even really appreciate and understand what goes into even a dispensing activity, right? And all of the checks and balances that are there. And I think that's been a challenge, and just communicating that to patients. But this has given us that opportunity, as you said, to be very service oriented. And we're implementing a service model within a distribution transaction model. And that's two very different things. And maybe, Mina, you can talk about that from your practice.
It's been a huge shift. We're seeing a lot less of people throwing the prescription down on one side of the counter, running to the other side, and saying, is my prescription ready? They start to understand a little bit of, this takes time. This is a process. There's some checking. There's stuff that has to go into this. We've been hearing a lot more, I understand that you're busy, I'll wait. Or, when can I come in for this? It's no longer this instant gratification pharmacy world that was happening for as far as I can remember, really. People are used to scheduling their appointments online now. So they would go into our booking app, and they want to get a med check. They will schedule an appointment for a med check. They'd like to get their vaccine, or they want to get an appointment for a COVID test. Then they're doing the appointment for that as well. When can I come in is a beautiful question that I love to hear, because I've never heard it back in the day. It was just show up, 5 minutes before closing with a list of scripts that they want, and it was craziness. But thankfully, the perception has changed quite dramatically of the profession. I think it will keep changing. There's more trust that's coming into the profession, and hopefully it leads to more things like minor ailments.
Yeah, and I think we're setting ourselves up for success with this model as we roll out things like minor ailments and other services that will follow. Last question. I know we've covered a lot of territory here beyond just testing, but I think it does sort of come back to that core about, what does the future of the pharmacy practice look like, and how do we embrace this and do it in a way that manages all of those unique challenges. But vaccine mandates has been a hot topic throughout the pandemic, within education, within healthcare workers. Doesn't have consensus. We don't have, for community providers like yourselves, a mandate. What's your view on that? Do you think there should be a mandate, particularly if you're doing testing? I mean, the risk threshold is quite high. And have you had to deal with that within your own practice of somebody who may not be vaccinated or not wanting to get vaccinated, or know those types of scenarios? I'll start with you, Mina.
So we have a vaccine mandate in practice. I don't really, all our staff has their boosters done. So it's not just, are you vaccinated? We were hiring a new staff, and the first question was, are you vaccinated? Because of one simple thing is, we can't afford time off for us, and we deal with very, very vulnerable populations. So if we carry something to a patient, we can kill them. There's no ifs or buts about it. So it's a responsibility for us to keep people safe. So it's a responsibility to keep our staff safe. And if you're working in healthcare and you don't believe in vaccinations, you're probably doing the wrong job. So maybe this isn't for you, and we both go our separate ways.
I think that's really well said, and it needs to be said more often, right? That particularly as believing in science, believing in the data, and being part of a vaccination program. If you don't believe in it, then that's contrary to the oath you're taking to protect your patients and serve your patients. So I think those are very wise words, and we've been out there talking about this. And it was surprising to me when I first mentioned about vaccine mandates for pharmacists that there was considerable blowback, and got a lot of messages from members who were quite upset with that, and that surprised me. I must admit, I wasn't prepared for that, because I just assumed, okay, you're a pharmacist, you understand the science behind vaccinations, but I think we're slow. I mean, we're talking about a small cohort of people, right, and likely less than 5%. But just like we're seeing with anti-vaxxers and those that are vaccine hesitant, they tend to be a loud minority, right? And using things like freedom and, I think conspiracy theories, and I think they've lost that plot, but we still have that last mile of people that are resistant to it. So Jen, what are your thoughts on vaccine mandates, and how would you approach it as an employer, knowing that you're giving, access to vulnerable patients and so forth?
Yeah, I think what it comes down to for me is, are we healthcare or are we retail in community pharmacy? And if we're healthcare, vaccine mandate only makes sense. And, I wholesale believe, obviously, that we are healthcare. What we do, we care for vulnerable patients. We're a trusted setting. We handle people's medications. So if we're healthcare, vaccine mandate makes absolute sense. If we're retail, then maybe we can get into that conversation. But in my mind, everybody who works within the physical premise of the pharmacy should be vaccinated in order to protect people who require the services of that pharmacy. Full stop. I've been lucky. We're a very small practice. I have a staff of 2, hopefully 3 soon, but we were all vaccinated. It was sort of a non-issue in my hiring practices, but absolutely, having that conversation around the expectations of safety with any new hires is something that's going to be part of that practice. But when it comes down to it, I think, if I were to look at it and go back to the beginning of the pandemic and sort of looking at vaccine mandates and testing, I would take it a step further, and not just a vaccine mandate, but you need to be willing to have regular asymptomatic testing when you're coming to work, because we know that vaccinated people can have those breakthrough cases and they can transmit COVID. So I think that whole thought that just being vaccinated is safe enough is something that's problematic, not just within healthcare, but within the community as a whole. And we're seeing that in terms of behaviors. But I think when we're talking about that with our patients, we need to be cognizant of that as providers, that just being vaccinated, being boosted doesn't guarantee that we're not going to end up COVID positive and passing that along. So I think testing, that rapid testing before shifts, maybe not every shift, but at a frequency that makes sense, especially if someone has, household contact that's been sick, that sort of thing, really needs to be something that we discuss more in pharmacy practice, because that's part and parcel of keeping everyone safe. The vaccine mandates are one part of that, but it's not everything just to have everyone vaccinated. So I would take it a step further and say that, if we're really wanting to talk about safe workplaces, we have to talk about testing as well.
Great points, and I want to just thank you both for sharing your insights. And all of this helps transform the perspective and perceptions of people about pharmacy and how they access the services. And I think that on top of everything else, it transforms how you practice too. Whether it's testing or you choose not to do testing, but you're doing other things like med checks and things of the, hopefully in the future, other services. That professional autonomy, the choice, and also the support that's going to be needed, mental health and otherwise, for the profession moving forward. You two are inspirational. You're influencers in the profession. I really appreciate your time. I know you're busy, but I'm hoping that others will hear your story. You'll hear about how patients have accessed the service for testing safely. You both implemented this in a similar fashion, utilizing the outdoor component and offering the various services. So, to me, that's what we really wanted to get across today, was that message that it's not for everyone, but if you want to do it and you have the right setup, you can do it safely. So thanks again for all your contributions, and thanks for doing what you do in helping your communities and patients. So that's all the time we have for today. Hope everyone stays safe.